Are you in every way, woman?
We're back with Every Way Woman and the doctor's perspective on life after treatment when dealing with breast cancer. So after they've gone through, all of this treatment, what can the women expect? What happens?
Well, it's a great question because a lot of times that's when patients kind of hit a low or even get depressed because they're doing all these things. They're having their surgery appointments, they're having their oncology appointments, and they're doing something active for the cancer. And then they're done with it and they kind of have to get back to their life. But, they're not doing anything active anymore to prevent the cancer. And so it becomes a time that we have an opportunity to help them move forward after their cancer diagnosis in a healthier fashion. We talk a lot about things that they can do to prevent a recurrence or another cancer, things like nutrition and exercise and eating healthy. I mean, these are all major things that may have played a role in the first cancer, but we need to make sure that they're doing the right things to prevent future events.
Okay, so it's safe to say that you don't let them go. I mean, you still, as the doctor, you still stay engaged with them. What happens though? I mean, because they're in such a state. How do you know when to let go, or how do you prepare them to kind of start moving along themselves?
Well, I think that's an individual question.
I would think so. I think each person is an individual. It's very hard to come up with rigid guidelines, but I would say at BreastLink, the oncologist follows them virtually indefinitely, as the surgeon. So,
how often does a patient have to follow up after treatment?
Well, it really depends on what the issues are. If there's a suspected depression, I think you get right on that. I had a lady in the office the other day that had arrhythmias. They're just out of the blue, but by following these people, you can reinforce good, healthy behavior. The nutrition, exercise is so big, so underutilized that some studies have shown it's almost as effective as chemotherapy itself. So we have to keep motivating people to do that. And there's a lot of things we can do, following the other breast, doing yearly mammograms. So it's an ongoing process. I have a very interesting case just yesterday of a woman I followed for 24 years. Her sister was diagnosed at age 24. We checked her for mutations. Everybody was normal in the family. We repeated the studies a couple of weeks ago, and she came up with an unusual variation that we didn't know about a year ago. And so it's extremely important to keep in contact and keep these people in our family.
So then what you can't say is after you've gone through this, you just can't say, I'm through. I mean, daily you have to take the steps necessary to be healthy.
Absolutely. There are some patients that want to be through, and those are the patients that we knock on their door and say, you've had cancer, we need to see you. I mean,
but what about reconstruction? I mean, I know that most women, is it safe to say, don't opt for reconstruction?
Well, in the country, there are plastic surgeons are distributed in different ways. So some patients don't have access to a plastic surgeon that performs reconstruction. So the actual number of patients that undergo mastectomy and didn't get reconstruction is very low. But fortunately at BreastLink, we actually have plastic surgeons around so that we have a very high percentage of our patients actually getting reconstruction.
Because you're so accessible.
Because we are accessible. So most of the country is an access problem.
And is that after treatment that you go through the reconstruction, or
it
is that
depends. Some patients, if they're caught early and they can informed about it and they have the access, they can get reconstruction at the same time as their breast cancer treatment. But for whatever reason, there are many patients out there that may have had breast cancer surgery in the past but didn't have reconstruction, and they want reconstruction now, and that can be performed as well using the same techniques. That's called delayed reconstruction versus immediate reconstruction, which is done at the same time as the breast cancer surgery.
Dr. Kieser, do you literally knock on some of your patients? I mean, literally, are you that in-depth in the aftermath to knock on the door and say, hey, Stacy, come on, I'm an advocate for you?
Well, I don't knock on every door.
I send volunteers for that.
Yes, that's why we have a very hearty volunteer program. No, we do, though. We send them letters. We ask them to come back. We tell them that, it's important to keep themselves healthy in the future. So we do try to keep them engaged. The hardest patients, actually, surprisingly, are the young patients. And
why is that?
Well, you could understand. If someone's had cancer in their late 20s, early 30s, it's kind of an unfair, experience for them, and they just want to forget that they had cancer. So
they just want to move on,
and forget that it happened. But that's also frightening because sometimes our younger patients are at higher risk for the cancer to come back. And we really need to keep them engaged. And there's long-term sequelae from some of our treatment that we need to monitor them for.
What about long-term side effects, Dr. West?
Well, there's all sorts of long-term side effects from the chemotherapy. Once in a while, we'll see an unusual cancer develop just as a result of radiation or chemotherapy. Sometimes it's just really hard to predict, and I think this is why Dr. Kersey and I are so committed to keeping these people in the loop, and we send out letter after letter, and sometimes we'll send out a registered letter when we feel that this is in the patient's best interest. And for the vast majority of patients, you want to keep them coming back, because there's going to be more and more progress made with time, and we're going to be able to do better in terms of detecting early changes and saving their lives.
Absolutely. We'll be back with more Every Way Woman and Breast Length. Stay tuned.
Are you in every way woman?